We have a list of unmentionables here. Some of the ones who have actually used technology in the healthcare space and have been super successful with it, and the others are who are trying to become innovative and bring in models that nobody has tried and tested before. I am privileged to be invited and to be with the esteemed guests today, and I intend to learn a lot along with you guys. This is one of my favorite panels, not because I'm biased, but because I think I understand technology and healthcare, and I believe these people have actually proven a case here. So, welcome all of you. Let me start with cracking a small joke. This will also help wake up a few who have actually gone to sleep. There is a crow who is actually sitting at the tallest branch of a tree and singing all day. And there comes a rabbit and say, "Can I also sit like you all day and do nothing?" And well, the crow says, "Yes, why not? Sit and chat and sing." And there comes a hunter and shoots the rabbit. So what is the moral of the story? The moral of the story is, to be sitting, singing, and doing nothing all day, you must be sitting very, very high up. So why we use technology in healthcare today is actually related to that saying. There is too much that is needed to be done in this space. The gap and the divide that we have, not between the rich and the poor, but also between the kind of healthcare that is available to people in India today. There is an enormous amount of work that is required to provide basic access to healthcare, primary healthcare to these areas. And that's why technology becomes imperative. You need to harness technology to reach those billions and millions of people in one go. And then the data that you collect, I wish I could show you how we do public health and how trucks and trucks load of data we collect on papers and how non-feasible it is to actually convert that into any kind of information so that you can rely and gain insights out of that. I'm happy that we have some technology companies and some of the large providers in our panels who will basically try and help us understand how important is this technology and what these insights are worth, and have they had some real life examples or real life cases in their practice where they have learned that using technology actually solved a majority of a problem or a big problem. So starting with Arvind. Arvind, tell me, I understand that you do a lot of technology in healthcare. Most of your products that you use today, you try and bring a lot of healthcare data and information to the cloud. And in doing that, you actually provide some kind of advantage to healthcare providers, practitioners, laboratories, basically the brick and mortar concept of healthcare. Tell us, what is one thing that you feel you have thought when you actually started this business, and what is the plus or the USP that ATTUNE Technologies today bring to the practice?
Okay. The one thing would be cloud, right? More and more healthcare is being delivered across multiple centers, right? If you look at the hospitals that are being built, people are not building 1,000-bed hospitals, right? But then people are okay to build 20, 50-bed hospitals geographically distributed. This is the case with labs, with specialist centers, with GP groups. So the trend is towards multi-center delivery, and that's largely because our population is like that, and India as a country is like that. So cloud is the single thing.
All right. So Varun, adding to what basically Arvind said, do you think that there is value in adopting such kind of technologies? As a large provider, how much value do you see in these technologies?
So, you know, unequivocally, yes, there is a lot of value. So, for example, we are one of, as far as we know, one of the only companies of our scale and size, leave alone the sector. We moved 100% to the public cloud last year. We shut down our data centers. It's resulted in, well, commercially significant benefits, economically, but more than that, it's improved our ability to respond, to react faster, to actually roll out initiatives faster, to scale on demand, and and that money that you save, the benefits that come back actually go back into giving better services or cheaper services, or actually rolling out new initiatives or investing in newer initiatives or activities to do for the customer. So, social the same way, mobility in a similar manner, analytics for that matter. So all of them have a lot of benefit to offer. The question is, which comes up is, how do you leverage them and what is the benefit? And I think that's the challenge which most people, I mean, I'm not saying just in healthcare, but it'll be across the board. You know, analytics is a big word, but what do you do with analytics? You know, you have the data,
Right,
but
so
what do you do with it? So
very,
those are the
very
kind of
good
questions.
question. So Sanjay, coming to you, Indegene has been there for quite a while now, and you've been working across length and breadth of healthcare, even pharma, life sciences sector as well. I understand that you have a lot of products and platforms that basically simplify a lot of things. What do you think was your motive when you actually set this company up, and what kind of value have you passed on to the sectors that you're serving today?
So essentially, bulk of the services that we've been focused on for this last several years have been targeted at the pharmaceutical industry. And primarily, a lot of them are medical, scientific, as well as analytical services. Over the last 4 to 5 years, we have invested in building up platforms which we believe are at the heart of the transformation in pharma. The transformation in the way pharma interacts with their stakeholders. Primarily, the pharmaceutical industry is a highly motivated industry to try and drive doctor behavior as well as patient behavior, right? And in that context, there are obviously mega bucks behind that as well, which is why, from our perspective, it was a great commercial model to begin with. The platforms that we've invested in have been primarily to kind of help a pharmaceutical company, whether it's a medical function within the pharmaceutical company, a promotional function, or a pharmacovigilance function, to connect directly with a healthcare professional or with a patient. In the bargain, these platforms are actually throwing up data that earlier was not available. And you will hear terms around closed loop marketing and, you know, huge amounts of data associated with pharma. And pharma is obviously trying to understand each customer. Over the last year or year and a half, ever since the Accountable Care Act came into play in the US, we've been able to use some of these platforms and capabilities quite effectively in doing some of these analytics. So looking at retrospective medical charts and being able to analyze where are the gaps in practice. Right now, it is a semi-automated process. Over time, as there is more and more data which becomes pretty much like the reference against which you can bang any of the new practice material that's coming in, hopefully more and more of that may get automated in terms of being able to identify what ought to be the practice and what is happening in reality. So it is still a bit of a gray zone, but I think that's really where we've been able to deliver value even to the healthcare business, healthcare providers in the United States. We haven't really explored that to a large extent here in India. In India, more of what we have done has been with pharma behind us, helping to drive either doctor engagement, so medical information on demand about the products, about the disease, latest clinical trials, but also to drive patient behavior. So again, pharmaceutical companies sponsoring patient compliance as well as patient adherence kinds of programs, and where we've used our platforms and services to be able to offer that.
Great. Coming to you, Ravi. You have come across, I mean, I got identified with you today and realized about a new innovative stuff that you are doing. Why don't you tell us something about what you are doing in this space and what motivated you to come up with that idea?
Okay. I used to be running Max Group of Hospitals before this, and I noticed that people don't understand tertiary healthcare. When they have a tertiary healthcare problem, they're dependent on a doctor who spends 5 minutes with them and says, go and get this surgery done. Then he comes home, there's confusion, you check with the family. So there was a need here, a very strong felt need that people need to understand what is the serious problem I have, what do I do, where do I go? And that is the reason why Credi Health has come into being. And we use technology to let people access good doctors, good content, and good information to make more informed decisions. And we break geography barriers for people to access superior quality healthcare.
Which is great. So that's why I said a magic mix of, so something which is done for the industry, where the industry moves to the cloud, where somebody is doing something for pharma appliance sciences, and there is direct to consumer. So absolutely fantastic. Tell me something, and I would basically try and have each one of your insights in understanding the health insurance play in India, and I understand that it's not that we are experts in that, but from a technology perspective, I want to know, in India, still claim processing, underwriting, and everything happens through paperwork. So there is a lot of paper in the industry. And though we say that we have moved to the cloud or better technologies today and so on and so forth, it is a long way to go paperless. Where do you see the industry is growing today in terms of the continuum of care and specifically the payer part of it? And how important is that to go paperless today? Yeah, we can start with you.
Sure. I mean, it's extremely important, right? Lot of insurance processing happens based on paper. There are isolated mechanisms to automate, but it's very patchy. Especially the edges, which are the interactions between hospitals and the payers and the providers are even worse. Given that the contribution of insurance to the actual revenue of the hospitals are on the rise, the more the automation, better it will be to make sure that hospitals actually make money out of it. The lesser the automation, the more tedious it is to even make money by the provider groups, and we know based on experience that this huge bunch of receivables from the payers to the providers for a lot of administrative reasons. So on one side, on the provider side, we try to automate those processes, but the payer side is as bad in terms of automation. So there's a real need for it. People are trying to build two things. One, the core insurance processing systems, which are at much higher level of automation. The second one on the edges, where we need to have standards to make sure hospitals or the providers in general are able to connect with payers in a very systematic way to make the transaction seamless.
What do you like to add on to that?
So about 15% of India has coverage under insurance. About 4 or 5% I think is with the private insurance side. Then there is the government and armed forces, ECHS, CGHS, etc. Interestingly, the government side is actually moving to online closure faster than the rest of the industry is, which is a movement we've seen in the last, in fact, we deal with a lot with the ECHS, CGHS folks, and there's a lot of focus now on actually clearing transactions and settling claims online. You have to transact online. There is no paper going through. Anyways, so the government agencies seem to be moving faster on that space than the rest of it. That said, there is already work and there is rules coming out, drafts coming out, where insurance claim settlement will move to an online side. TPAs to some extent have, some TPAs have moved to that area. I think that the key here though is that will it add efficiencies to the system? Yes, it definitely would. But to the point that Arvind was saying, I think the bigger thing here is on the receivables, which helps hospitals function better, which healthcare service delivery providers like us to be able to more efficient, to actually service our customers better, because the cash flow management becomes the key there. The technology exists. I mean, it's not that the technology doesn't exist. It's more a question of adopting it and driving that transparency and efficiency into the system, which is there. It will pan out. It is the only direction it can move towards. I mean, we can't move back towards paper.
So I think my audience has a common consensus, and please raise hands if you agree with me, that EMR and PHR never worked in India. How many of you agree that EMR and PHR, we have heard a lot of models, but they never worked in India? So I want to know whether you agree with this, and if yes, why?
Well, it has never worked anywhere else. Why just India? People are paying money to use EMR in the US, right? Still the adoption levels are to the extent to take money, right? So this is fact. I think in my mind, there are two reasons why people would start using EMR in India. One is regulation, the other one is health insurance driving it. Given the democracy we are, I don't know if there will be a strong regulation to make sure that people start using EMR, so I'm setting that aside. Very likelihood is insurance driving EMR adoption in the country, but that is still going to be super patchy, to the extent that insurance claims are done properly, and not necessarily for better healthcare delivery.
The insurance paperless not happening affects service delivery. A patient goes to get admitted for a procedure tomorrow, he doesn't get a bed for 5 hours. When he has to be discharged, the doctor says you can go home today, but he goes home only at 6 in the evening. All this is affecting service delivery. Many people do, a lot of unethical things happen because of the paper. The government, four government-owned insurance companies, their claims are more than the premium they collect. That happens only in India, nowhere in the world.
Well, that is hard to say. I probably disagree with that. I have seen many countries where this happens.
So just to the EMR, PHR question that you asked, so, to Arvind, he's right. I mean, even the developed world is only in the last 2, 3, 4 years driving towards EMR or mandating an EMR to be put in place. The challenge in EMR is not that it has not worked. It is just that it's not been effectively implemented. We see it as a cost, but there's also a value in it. So, and if you see, say, products like Health Vault, which came from Microsoft, it's free for a user like you and me. Okay, but no one ever put in data. So there's no charge to it, but it's still not in use. It's just a way of an individual, a consumer, to manage his or her own health records over a period of time. So like I said, the challenge is not that it's free or it's not free, or it's paid or it's not paid. It's the value. And we are moving towards a very socially aware consumer world, where the value is what matters. If there is a value in it, someone will pay for it or not.
I think both for the consumer as well as for the doctor, because doctors generally say that my patient is only going to give me rupees 500 per consultation whether I host his EHR or not. So I better not host the PHR and save that cost. Please add, Sanjay.
Again, not getting into the technology of it, but I think the riding word that Varun pointed out, somebody is mandating it, right? And right now, given the penetration of health insurance in India, right, until that kind of really pans out in a bigger way and it's mandated at a larger level, I don't really think we're going to be able to derive the value of EMR. If we had to step back, actually, not from more of a, and look at it more from a social point of view, if you look at healthcare in India, I think the problems are much larger, right? Access to basic healthcare is still an issue, right? Which is why some of us, for instance, are spending all our time on investing in technologies which will connect people remotely. And I know, for instance, you were talking about it in the pre-planning kind of session, that hospitals such as Max and stuff would probably be doing that, or Fortis would be, etc. But I think until insurance really penetrates into this marketplace, you're not going to have a disciplined approach to EMR. And until you have a disciplined approach to EMR, you're never going to be able to mine it in order to kind of create practice guidelines, be able to drive practice excellence. And there's no financial motivation, right? Until someone says, you know what, you're not going to get paid for a service, you're going to get paid for an outcome, right? There's no reason to kind of collect this data and analyze it.
So Ravi, I'll come back to you with a consumer question. I have a doctor question with Arvind. Arvind, what is the pain point of doctors by which you can actually ask them to adopt technology? Where can you convince the doctor to probably use a cloud-based EMR or a practice management software that is hosted on cloud? What is that pain point?
Okay, I mean, it's different for practice management and EMR, right? For EMR, if the data is available, they want to look at the data, because without it, it's it makes the decision making easier. It makes them take better decisions. The question is who puts in the data, right? So the larger issue is who puts in the data. I know some of our customers are using EMR and they are live with the EMR system, but they are still very niche in terms of what they are doing. It's not a broad trend at all. So the real issue is who puts the data. So what we do is, or what hospitals do is, they get some assistants to put data for the doctor or the consultant so that he gets to see it when he wants it. Everybody would want to look at the lab report, radiology report, bunch of prescriptions, history examination, investigation, so they will want it in the fingertips. But your ability to feed it in is the critical part. If you are able to figure that out, then the adoption question is really answered there. I don't know the answer yet.
So
I love that candidness.
To what Sanjay was saying, I think the challenges here so there's the demand supply in healthcare in India there's a huge mismatch. We have a need for catering or serving a lot of patients or people in need, but we don't have enough time in the day with the doctors we have to cater to them. So adoption of technology, especially at the doctor end, and coming to the point he's saying is, that it depends on how efficient it is. If you add a couple of minutes to the time they spend to capture the data, you've lost the plot. Because it's not a question of quality then, it's a question of I have 5 more patients to see. So do you want me to enter data or see 5 more patients? So you have to find a way, so typing will never work in India in the current context. So it has, even selecting from drop-downs, for example, takes time. Is it writing? Is it inking? Is it, different ways to do it? But that innovation has to happen on how to simply capture what the doctor is saying. How do you replace a paper with another device? So they continue to work the same way while not spending any additional time. If not, I mean, they should be saving time, actually. The key is that.
Okay. So Ravi, the consumer question. What drives technology from the consumer perspective? Why would a consumer adopt technology? In which cases? What is he thriving for?
For a consumer, it's convenience. Instead of carrying a big MRI report, if you give me a URL, I can go and take my second opinion easily. So that drives technology. Today, in big cities, very few radiology reports, URLs are available. So we tried to do a pilot in Max, and it was very well accepted by the doctors. They could see big reports on their smartphones. So a consumer wants to likes technology. And he wants to use it more and more to access healthcare.
So if I have to answer that question in terms of what drives a practice management software, if you will, in India, I can think of probably 2-3 things, and pardon my ignorance there. I think first thing is the customer delight factor, which means that, okay, your things are hosted in my server and I will give you reminders, or for your second visit, probably help fill your prescriptions online or remind you of your second appointment coming in and so on and so forth. So the first reason is customer delight. Second, it's the cool thing, maybe for new age doctors also, to use technology and show that, a lot of processes are automated and the practice is basically managed through technology. And the third reason why people use a practice management software is also because these are very small clinics where there is not much assistance in terms of paper keeping, record keeping, and they want to be familiar with their patients when the patient walks in again saying, "Hi Dr. Gupta, how are you doing today? How was your kidney operation and how been you feeling after that?" Maybe these are 2 or 3 basic reasons why, why people have started using practice management software. Coming to you, what was the pressing need in the pharma or life sciences industry because of which the advent of technology actually happened in this sector?
So, I mean, at one level, technology, if you look at basic research, obviously it's been steeped for a while, and high throughput screening and all of that is a separate part. But the technology that we are talking about, which is more of the multi-channel technology, was driven primarily by market forces. Pharma traditionally was used to a sales rep model, sales reps going in to meet doctors, detailing their products and coming out. Access was becoming a problem for a couple of reasons. One is doctors weren't seeing enough value in that interaction. There was more and more regulation coming in so that, pharma couldn't just do anything. And more importantly, they just didn't have the time, right? So this was actually yielding a very poor return on investment for the pharma industry. Increasingly, doctors were going online to access information, credible information and information which was relevant at that point in their practice, not some, article. Nobody wants to read a book, just general textbook at the end of the day. If you have a specific problem, what do you do? Or if I'm using this drug, what are the precautions I need to take? That kind of stuff was moving doctors to a multi-channel environment. And what was happening was pharma companies obviously were off to the races. Every brand manager, medical guy setting up some website. There was a call center that was set up, some mobile, SMS kind of program that was put in place. But guess what? Very quickly what ended up happening is there's one doctor and there are 6 channels from the same pharma company talking to him or her, and they're not talking to one another. So you're essentially, your sales rep is going in there trying to sell you information which you have already accessed from the company's website. So there was no way to close that. That's why we invested in technology platforms that allowed that. And secondly, invested in technology platforms which could allow the doctor to pull a conversation with the medical person inside a pharmaceutical company on demand without having to download any widgets and stuff like that, etc. Be able to have a compliant conversation. And again, pharma is obviously a place where we need that compliance oversight more than anywhere else. So that's what caused us to kind of invest in those kinds of platforms. And given that this was all yielding data, which was valuable to them, we had to create tools to be able to collect data from different channels, whether it's a digital channel, mobile channel, the sales rep channel, a call center channel, so that you as a pharmaceutical company have a view about a physician. And you can basically then cater to that person's needs based on his or her behavior across channels. So that's really what drove the investment in technology.
Well, clearly, the healthcare landscape is changing all across the world. Today, as a consumer, before going to a doctor, I Google up. After coming back from the doctor, I Google up a prescription. And it was never there before. There is loads of information, loads of means and measures that are available today in the market, as they were probably 15 years back. When somebody talks about a B2C model versus a B2B model in the market and asks me a question as to which is a more profitable model, or if you want to follow the money, where should you go? What are your views on that? Because that's pretty an interesting topic, and I don't have an answer myself, so maybe I can learn from you guys.
Okay, so this is not just in healthcare. In general, B2B takes less money. The return on investment on B2B is much higher. However, the absolute value is significantly different in B2C. Right? So you look at e-commerce companies, you look at any other companies, the absolute value is totally different, but then the return on investment is much lower. In B2B, the absolute investment is not as big as B2C, but the return on investment is significant. Right? This is the difference. The question is, if you are able to build a model, if you are able to raise money, it doesn't matter where you go, right? As long as you are solving a real problem. The key is to figure out the real problem, whether you are in B2B or B2C. And my view is, especially in healthcare, I mean, I know there's a B2C model in there. For the initial phase at least, it will be B2B2C, right? So labs empowering patients, hospitals empowering patients, IT providers working through these entities to make sure data is available online, their experience is better, immediate information is available, giving them feedback, tracking information. The initial phase could possibly be B2B2C before directly we go B2C.
So Varun, coming to you, where do large providers want to invest in innovation? It's a tough one.
So, there was a question you'd asked earlier on what does the consumer want? Right. The thing is, when we respond to these questions, we actually start talking healthcare providers. But we have to actually look at it in two ways. What does the consumer want? Who's the end consumer of your service? That's one perspective. The other is, as a business, you need to do things, which is so what the company wants. So where do you invest your expectations from the technology? Yeah. So clearly, in today's day and age, so like you refer to Google, so we call him Dr. Google, and he's the bane of all doctors. So I do it myself. I actually will Google my symptoms. And when I go to the doctor, I'm actually going for ratification, okay, not for discussion. It's more like saying, this is what I got, please confirm. So it's problematic. Right? So we've got to, the consumer is becoming a key driver. Let me qualify that. The consumer, the limited consumer that has access to healthcare is becoming a key driver. Okay. And catering to the needs and the desires of that consumer is a key area where investments need to go in. Okay, that's one. So you call it B2C or you call it direct C. For me to be able to service a consumer, I need to be able to cater to some needs that the consumer has, because that builds the trust, the convenience, the comfort, the access, etc. Those questions. Can we invest in technologies which will allow me to keep the patient or the potential consumer out of my hospital? Can I deliver care at home? Can I consult at home? Because it also helps the business. I can actually see physically another patient there in the meantime. Similarly, on the healthcare provider side, you will look at different aspects. So, efficiencies, you will do ERP systems, technologies in that way. Cloud adoption, for example, so, if you simplistically explain it, it's just a data center. It just doesn't matter where it's sitting. Right? Cloud adoption, does it unlock value that you can invest somewhere else? Okay, so technologies, investments would go into those kind of spaces. Technologies where I can actually reach out to my consumer where he is, deliver a service to the location he's at. Can I actually reach out and you know, touch more people's lives than I can currently from the brick and mortar world that we live in? So both are equally important. The first one from the consumer standpoint, because you want that brand to be built where people actually, you know, you know, like they say, it's your brand is no longer what you tell the consumer. Your brand is what the consumer tells other consumers. Right? So it's very important to cater to what people need so that they can speak of your brand, so you can drive more, you know, consumers or customers into your business. At the same time, you have to look at improving your profitability, your margins, your clinical quality, your care, etc., to cater to what your organization needs to survive. So it's an equal investment. It's not one or the other. It has to be a balance and has to be investments across both.
So Sanjay, you talked about the Obamacare right now, and we had Dr. Shantanu in the last panel who basically talked about that the NHS model of Europe is a good model to replicate or probably try it in India. I personally feel that if there is, in the audience, if there is somebody from the US, we just hate healthcare insurance companies in the US, but I personally feel that the quality that is there in healthcare delivery in the US today, it's because of the payers there. Now, outcomes drive a lot of technology in the US. What kind of outcomes, or do we need outcomes in the Indian market to drive technology as well, right at the consumer level, at the doctor level, at the enterprise level, and other levels in the healthcare industry?
Undoubtedly. I mean, at the end of the day, if we are going to simply say, we just lay this all out and not worry about outcomes, hey, what are we building, right? The issue is we've, for various reasons, because of the fragmented nature of our industry, because of the lack of access to so many millions in India, to talk about outcomes today becomes a little bit of, it almost sounds as if this guy is talking something very futuristic, and you know, there's no point in going down that road. Just let's right now reimburse people for a service, which is fine. But as penetration of insurance comes in, that's when insurance companies will drive outcomes, because it's monetarily, commercially right for them. Unless there is someone who's got a skin in the game, you're not going to be able to drive outcomes, right? If it's going to be some public health kind of, not public health, NGOs are still driven by outcomes. But if it's going to be some of the, you know, kinds of things that we've been used to over the last several years, you know, where you get a WHO grant, and I've seen that kind of stuff. A WHO grant comes in and the government of India is like just distributing high-end automated equipment in areas which don't even have 220 volts AC, right? So you're talking about completely misplaced investments. Until that money begins to count for something and somebody is, you know, actually looking at the return on that investment, you're not going to basically ask for outcomes. And in order to deliver outcomes and measure them, technology is absolutely essential. You'll have to move away from this paper thing, because there's no way physically that you'll ever be able to mine through that and be able to get, you'll have to create a separate industry just with people who are reading reports, which is not going to work.
So I think we have a common consensus that data is very important. Insights and analytics are equally important, and we need to have to get rid of these redundant, not interoperable systems where data is just lying here and there. Now, I have a question, and these are business questions, so I'll start with Arvind. Arvind, you are moving a lot of stuff to the cloud. Now, when we talk about continuum of care and we talk about healthcare as a whole in India, in rural areas where internet connectivity is not at all very impressive, how do some of these models cater to the wider audience, and what is the scale basically to which you can grow in the future?
Sure. So internet connectivity is a prerequisite for the cloud model to work, right? What's happening is a huge push from the ecosystem standpoint, from a technology ecosystem standpoint. I'll give you an example. When we started the company, I had to buy a server, put it in the data center. None of the data center providers were offering true cloud-based services then, right? I mean, I still use the server for testing. It's there in the data center. But as we started building cloud, you know, our platform, the ecosystem kind of caught up. Now we have cloud providers who offer the infrastructure and platform as a service, which is very good. What's also happening on the internet connectivity is it will only get better and better. Today there are challenges with connectivity in areas for sure, but with the rollout of 4G, it is only going to get significantly better, and we are working with few top companies that are equally concerned about broadband penetration and internet connectivity across the landscape. Till the connectivity gets better, we have a technology option where you can deploy local, it synchronizes to the cloud infrastructure. It is not ideal, it's not the way we want to go, but till the connectivity kind of catches up, this is a stopgap, but we look at it only as a stopgap.
So that reminds me of an incident where Apollo tried to do telemedicine several years back, and we got a 3G spectrum from Ericsson at that point in time. There used to be these vans that used to have a dish on the top, one bump on the road, and it used to roll out 360 degrees, and there was a complete blackout. So sometimes it happens that when technology is pushed in a way that the spoon is too full to eat, sometimes it is counterproductive than what it should be.
Just one other point I want to add, especially with respect to internet connectivity. Frankly, it's a myth that Tier 2 does not have connectivity, right? In fact, I would go ahead and argue Tier 2 has better connectivity, and that's largely, and for example, Delhi doesn't have connectivity, right? I have customers in Delhi, some of them are here, wherein I am not able to run them on cloud. I have a local installation synchronizing back onto cloud because there's no connectivity. And it's not a military area, still they don't have connectivity. It beats me. However, if you look at a Tier 2 town in Tamil Nadu, I don't know how many of you know Veerappan, Forest Brigand, yeah, he got killed. But his native town, so I have a hospital who is a customer in the native town, and I'll tell you what, they are live for 3 years on our cloud with a BSNL broadband. So BSNL broadband has connected most of the Tier 2 towns. The broadband, so broadband works on a basis of sharing of the pipe, right? In Tier 2 towns, the number of concurrent users on broadband are not very high. So technically, the broadband performance is much better in Tier 2 town than in a city of similar speed. However, the issue is it's not reliable. Wherever there are reliability issues, then connectivity becomes a problem. So it's a bit of a complex problem. Yeah.
All right. So another business question to you, Varun. We have seen, and this is, please don't take it personally, but there is a lot of investment that large healthcare providers do in medical technology, cyber knives, medical precision, quality. But we have seen very little investment, and there are startup companies out here, on behalf of them I'm asking this question, a little investment in analytics or communication technology and so on and so forth. So why is that, and do you see that is changing?
So I don't agree with that statement. It was true, I think, about 2-3 years ago. But in the last couple of years, there's significant investment in the non-medical tech side, which is happening. Simply because, from the business standpoint, you've got to become more efficient. You've got to be able to reach more customers. You've got to be able to deliver services better. So there is a lot of investment in the last couple of years which has gone into this. So be it EMRs, HIS systems, be it VNA solutions, PAC solutions, teleradiology solutions, teleconsult, virtual clinics, so on and so forth. It's all happening as we speak. So for example, we've invested in a remote eICU solution where, from one of our hospitals, they actually reach out and manage critical patients in remote hospitals. Okay. So it can't happen without the tech or without the connectivity for that matter. There are solutions where we are offering pregnant women remote monitoring services. You actually can strap up a thing on your belly and walk around and you're being monitored remotely. So a lot of investment is going into it now. The interesting part is that it doesn't necessarily have to be dollars put on the table. It is also a lot of partnerships forming out to do this. It's a pay-per-use model which is coming up. So what the cloud is now coming into play, it's that strategic relationships have already started forming on a pay-per-use model as that goes.
So next question, thank you for that. That was very insightful. Sanjay, you are helping a lot of pharma companies getting insights, what they never had, the data was not available. Do you also have some indirect outputs related to adherence, compliance, that come out of what you actually use as technology processes?
Oh, absolutely. In fact, that is the major driver for pharma actually investing in some of these solutions, because especially for chronic therapies, it is far more cost effective to keep a patient on your therapy than to bag a new one. And again, I'm sorry I'm making it sound so commercial, because at the end of the day, it's a for-profit kind of organization, right? So under those circumstances, there are 2 or 3 drivers there. On the one hand, to drive better adherence and compliance, and that can be done by providing technology-enabled solutions in terms of medical information, support, but on the ground also being able to provide nurse counselors and stuff who can help these patients manage themselves better and stay on the therapy longer, manage side effects and stuff. So that is one part of it. The other side of it is a little more cynical, if you would put it. From pharma's point of view, increasingly, they are looking at providers, whether they are provider organizations or individual providers, say, how do I service this person better without, now that the whole thing about gifting and cocktails and all of that is gone, right? I'm no more just a pill provider, I'm a solutions provider. And I will position myself as such, and therefore, while my customer base, a hospital, is not able to make the investment in following up with the patient after the patient has been discharged, I will provide that service, and I will share with them to show that the service that I'm providing is fair, balanced, and is not aggressively pushy. So that's really the direction in which those funds are flowing. And in that context, some of the programs that we have done, even here in India, have delivered outstanding results. We can clearly show an increase in adherence and compliance, and the fact that the overall perception of that company as well as its products in the minds of providers has gone up.
So as we reach to the closure of the panel, my last question is with Ravi. Ravi, tell us something about Credi Honor and the patient support groups that you have created using technology, and how are they actually helping the consumers?
Okay. So like I was sharing with you earlier, we created a PCOD community, and the PCOD community is a gynae topic, and there are lots of women in India who keep calling us. We get about 15 to 20 phone calls a day. That's what prompted this. It doesn't mean business for us, but we want to engage communities. So now we have a PCOD community which is going global. It's on the Facebook, and 60% of the members are not from India. So we want to nurture and encourage these communities so that people help each other, because Credi Health is wanting to make an impact. So we are now working with some NGO foundations to create cancer communities, from prevention to rehab, right through the value chain, different communities and different kinds of cancer communities, children's cancer, breast cancer. We find there's a strong need, there's a strong social need for people with similar ailments to come together and help each other, share their experiences, give feedback about treatment so that there is more transparency. So that's the power of these communities.
So I clearly feel that some of the new age startups and support from large healthcare organizations have actually made data and information available to a large extent, so that the insights are used not only for business interests but also to invest back into the society. With that, we reach to the closure of the panel. Thank you so much for sharing your views and coming up here. I thoroughly enjoyed myself. Thank you.